Everybody, it's Matt and welcome back to OK Aussie. It is Thursday, the 25th of September. Dyan is starting to feel a bit spacey, going offline, and most likely, unfortunately, about to have a seizure. 5:30 p.m. Just getting things prepared. I've already put the pulse oximeter on just to monitor, and we've already had the first set of alarms going off. As you can see here, we're actually having oxygen drops all the way down to 91%. It's flapping, heart rate's actually hitting lower thresholds already and been alerting at 50 beats per minute. So that was a bit of an initial sort of concern. The blood pressure for Dyan has been taken, 103/67, heart rate is 52 beats per minute in that. That's the alerts that you're going to hear. She's got some ice on her neck at the moment. We've just been out and about. So she's got a lot of pain to deal with from the travelling in the car just for a little outing. You'll see that in a previous video. It's taking her flat. So, temperature is actually not too bad for her at the moment. However, it is 23 degrees outside. In the room, it is 24.2 degrees. So we're in that working operational ideal sort of temperature. But we're ready. We've got medical oxygen concentrator ready to go because of the oxygen dropouts. So
busy.
You're busy. Wow.
I was working.
You were working.
I was editing.
Right. So let's just double check what has actually happened so we can get in front of it, hopefully. You've taken your evening medications already at 5:13. Stay with me. That's included, what have we got in there? Heart rate drop. Yeah, heart rate's going down, 48, 47, 46. All right, so we've got heart rate drops occurring at the moment. She's taken the evening medications at the right sort of time. Okay, so we're taking the ice away from you for the moment, just in case that's causing anything. Let's have a look at a few other things ready to go. Your head's hurting, is it? Okay. Sweetie, we're going to give you some clonazepam immediately. While you're able to focus, pop it in. You're swallowing this right now for me, please. Put it in. Good girl. While you've got the ability to swallow and do that, let's actually try and do that while we can. Makes more sense to me. You're in pain with your head, so let's give you some CBD as well.
It's like my eyeballs hurt. I rub my eyeballs and they're hurting.
Okay, no worries.
My eyes keep closing.
That's the blepharism. Okay, here we go. Good girl. Alright. So, just provided to her clonazepam 2 milligrams oral tablet. I've given her some CBD, THC 10-10 combination, 0.5 mils. Normally that's scheduled for 7 p.m, an hour and a half from now. Providing it now, she's probably going to go into dystonia and seizures, so we'll try and get rid of what we can.
I'm busy.
You're busy. I'm glad you're busy, sweetie.
I was going to watch the KFC. Mike's man cave's done KFC.
Right, mate. One man's done KFC.
Yep.
That sounds brilliant. Lucky Mike.
It's yummy.
Alright. Heart rate's at 55. Oxygen is at 97, so I'm happy with that. So just before all of this started to happen, I had concerns because we've just got back in from taking Dyan for an outing in the car. She's done a couple of stops. Hasn't been extravagant. She's been in the wheelchair travelling backwards and forwards. But she did indicate on the way home the flickering light as the sun was coming through on her side was starting to annoy her. She was indicating agitation, sensory overload. Dyan is autistic, ADHD, OCD, and has Tourette's. She's got an umbrella condition, 22q 11.2 Deletion Syndrome, and with that, we've got high prevalence.
You need different sunnies. I need.
You need different sunnies. I agree with that.
Sunnies.
Very low threshold to seizures for 22q. In fact, 65% of patients with 22q will have seizure-like conditions. 8.3% of them will have epilepsy.
I'm getting ski glasses.
You're getting ski goggles? No worries. So it was in the car while we were travelling, but I'm really noticing behavioural change. Agitation, sensory overload, really feeling what she was wearing. The ring was too much. The earrings were too much. The clothes were too much. Okay, so we've got that sensation. The glare from the sun was too much. Yes, you can. Absolutely, you can, sweet pea.
It's pulling too tight. I can't handle the pain of my scalp.
That's okay.
My scalp is hurting.
No worries. Right, oxygen sats at 96, heart rate is at 56. Temperature in the room, I'm going to bring down a little bit. Try and keep it as cool as we can. We want to bring it down from that 24.4. I want to bring it around to about 23, 3.5 ideally. So that's where we want to go to ideally. We've just covered muscle relaxant, so we're going to try and get in front of any dystonia. She's indicating blepharospasms already with the eyes and the ability to manage and control the eyes. That's part of the segmented cranial dystonia, so the clonazepam now will help. Hey Google, set timer 20 minutes. Within 20 minutes, that medication, the clonazepam, should be enough to actually help. However, she's at high risk of seizures right here and right now. I can see the mandibular activity with the jaw and pushing up the muscles and muscles of the cheeks. She's engaged in that. So, as she was in bed, we've got her straight home, we've got her in her pajamas, we've got her relaxing in bed.
I got punished for going out.
You got punished for going out. I get that. Okay, and unfortunately, previously, you haven't really been out much. You've been out for, what, once in a whole 30 days. You have been bedbound that entire time. And this is Sleeping Beauty effect, Dyan having ME/CFS, myalgic encephalitis, chronic fatigue syndrome.
Look at my fat.
Honey, you're not fat, sweetie.
I am, because I can't exercise. I can't.
Well, you can exercise, and that's unfortunately with the multiple fatiguing conditions. You've got limitations until we can get you to hydrotherapy, which is a summer mode activity.
Eat the food, but you know what?
Right, sweetie.
I could eat KFC because of the chicken.
No, you can't eat KFC because of the chicken.
Yes.
Right, but without the crumbs, yeah.
With the gravy and mashed potato.
That would be nice, yes.
That would pass.
Okay, you keep working on that one. All right, so I've set a timer for 20 minutes because I'm hoping that the clonazepam will be enough to get in front. The CBD will help. I can ask you a few other questions.
What?
Right, any nausea?
Yeah, mild.
Okay,
It's mildly sick, but no, I don't want to take one. No, they lose effectiveness, so I'm not taking one.
They actually don't?
No, I only take one when it's bad.
Okay, so rather than getting really bad and when you can't actually control it, you've already got mild nausea. Part of my challenge as a carer with Dyan, you want it now, don't you?
I do it myself.
Let me open it because in your cognitive state, here it is, it's open, okay? Dyan will have struggles with coordination, executive functioning, and performing the simples.
Be a lizard?
Okay, good job, Liz. Girl, thank you. And Danzatrol, 4 milligrams sublingual, 5:38 p.m. Intraception with autism, very difficult to understand her own internal states. She's not aware while she's lying down, hey, there are things that are happening. My heart rate's doing some funny flappy things. My oxygen levels are going down. You're distracted. And when you're distracted, you can't focus on other parts of your body and what's happening. But that's why we've got the pulse oximetry. That's why we've got the alerts.
Hey.
What did you feel when your alarms went off?
Spacey.
So you felt spacey. Did that draw your attention to, oh, the alarms are going off, there must be something wrong with my body?
Yeah.
Right, and you felt, and you realised at that stage,
Confused.
my head is confused and I'm feeling spacey.
Yeah.
Did you have any head pain that you're noticing at all? Now, remember when we got home, because of all the travelling, because of the increase of pain that was going on,
I could still feel the sun doing that.
you're feeling the sun filtering. And that filtering through the trees as we're driving, it creates a flickering effect, and that's a key trigger with photosensitivity, because Dyan's photosensitive to seizures as well. Now, she indicated pain several times. I offered her medication in the car. She was determined to get home first. She has had half a rizatriptine max salt wafer. What you're hearing now is the vocalization part of Tourette's. We've got some motor tics happening physically. We've got some vocalization or oral tics happening as well. These are normally precursive. We can see them before, during, almost like after seizure events as well. So migraines, flickering lights, okay, feeling very fatigued. We know that you've had fevers almost every single day, okay. Yesterday you had a very bad seizure set, didn't you?
Was it yesterday?
That was only yesterday,
Okay,
exactly.
yes, it was yesterday.
And that's one of her worst ones, that she's had of tonic-clonic seizures for quite a while. But she had a lot of absent seizures we were noticing yesterday as well.
For days.
For days. Have you noticed absent seizures today?
No.
Okay, that's good. And I haven't noticed or seen you
No.
doing any, whereas the last 3 days, I have.
My pattern is absence, tonic-clonic,
Yep.
then the absence stop for a little while.
Okay.
And then,
So you're staying true to form to your pattern.
yeah.
Absence
And then
seizures
just before the tonic-clonic, I get
short,
focal aware.
almost like a reboot, where that's your heart rate spiking down again. We've got absent seizures where they last anywhere from 3 up to about 10 seconds. They are literally a blank stare. The mind is not functioning. The brain is doing like a reboot. Dyan is unaware of time and space during that. When she comes out of it, she won't know that she's had those, but that's why we have things like the SAMU 3 camera.
It's annoying because I watch
monitoring her at all
TV
time.
and I miss things all the time.
And that's why you rewind things all the time.
No.
That's my indication to know that you've missed things.
But like we talk about it, like we've been talking about Downton Abbey, and you're like,
Yeah.
oh, this, don't you remember? And I'm like, I
Yeah.
was watching it with you, but why do I not remember?
You're missing lots of little chunks of information.
Lots.
Exactly, lots. And that's a lot of absent seizures that are going on. Oxygen starts at 97%, heart
But
rate
my
is
other
55 at the moment,
pattern-
flapping still.
It's absence.
Right,
Then there's focal aware.
Bingo.
Tonic-clonic. As soon as I know focal aware, I'm like, I'm screwed.
right. Now, yesterday, the thing that initiated her seizures was a lot of focal seizures with awareness. Now, you can have focal seizures with impaired awareness or awareness. She was aware of what's going on but unable to move. It's like being locked in for Dyan. Sometimes you'll see her in a weird, awkward position. Sometimes you'll see certain parts of the body fibrillating or shaking and uncontrollably as well. Have you noticed any dystonia today at all, sweetie? Any focalized dystonia in fingers, hands, toes or feet?
No, I've been really busy.
Okay, so been a little bit busy and distracted.
And not focusing.
Not focusing on your body and where you're at.
know.
That's okay, that's no stress at all. Alright. Have you had any chest pain at all today?
Just before, at the beginning of this one, I said to you, whatever I said to you, I can't remember, you asked me a question, I answered it. Here's tight, but it's not tight anymore now.
Okay, so you had a bit of mild sort of tightness.
Tight. My heart doesn't feel happy.
Okay, that's all right, no problems at all. Well, your heart at the moment's been dropping down low. Now, Dyan is normally bradycardic, so her heart rate can go very low.
Maxie, come here.
She can also go tachycardia, and particularly around dystonia and particularly around tonic-clonic seizures. Yesterday, as an example, she was up to 160 beats per minute, just lying down, resting, doing nothing, suddenly going into that from starting at 55. So it's a massive jump, going from 55 up to 160, literally doing nothing except for your body having seizures during those events. A lot of the time, here we got an upper body torso tick just then, it's 5:43. A lot of the time with the tachycardia, she can have arrhythmias, feelings of irregular and skipping beats, and angina can also be present as well. There's a lot of questions that I have to prompt, poke, and prod to try and discover what's going on for Dyan, because like I said, she's autistic. She has a huge amount of struggles with distractions of knowing what's going on, and for her to go, oh, something else is wrong, this is where it's happening, this is what I'm feeling. We've got both cats, Max and also Willow, coming into play. We have oxygen at 96%, heart rate is just flapping at the moment around that 50. So that's where you're hearing the alarms go up and down a little bit. So we're actually starting the evening routine, which commences at 5:15 p.m. for us in this household, and that's part of our sleep hygiene routine. First set of medications start at 5:15, then we'll start at 7 for CBD normally, 8 o'clock for melatonin, 9 o'clock for things like phenergan. Baba, is your head hurting? Okay, if you can't control the hands, then I can pad your hands. We do have pads for uncontrollable activity. These are the pads that can be applied. Sometimes, in particular with Tourette's and Tourette storms, Dyan has no motor control and can do certain actions. She might bang certain things. She might hurt her own head. So if we have to, we can apply pads, and we have a whole range of things in the car available, not only to monitor, but also to help medicate or to help prevent or to help recover after an event. Your neck's really hurting, isn't it, Bert?
Yeah.
Okay. Oh, careful of that shoulder. Dyan's already had a full anterior dislocation of the right glenohumeral joint. She's actually got a broken shoulder, which is the Hillman sac injury, so it's very susceptible to popping and dislocating that joint out. She is hypermobile. She has Ehlers-Danlos syndrome, EDS hypermobile version, and unfortunately with that she can sublux and she can tick, and that can also cause full dislocations of any of the joints in her body. Now, if you are new to the channel, welcome. We are not medical professionals to give you guidance or advice. That's what your own GP, primary care physician or specialist are for. So please do seek them out if you have questions about your own health, healthcare management. What we are sharing as part of advocacy and education is where Dyan's at, dealing with her own genetic conditions, and she has multiple rare genetic conditions. If you're into rare conditions, don't forget to check out rareportal.org.au. It's an Australian site that actually lists all the different rare conditions, and you can see help groups, support groups, and information about those conditions in Australia. Okay,
I need
break.
How do we do this on?
Okay, so first of course at the moment I'm just going quickly for the helmet protection. Helmet we commonly use more so for atonic seizures, so that Dyan, if she's having drop seizures, she's not going to hurt herself, or of course if she's banging, then we've got some protection to the frontal lobe. Relax your fingers, Poo-Poo.
I'm sorry.
No, you don't have to apologise to me. Sorry, the money. Good girl.
It's like a sock.
It is like a sock, isn't it?
I'm a wrestler.
Well, as long as you don't become a boxer.
WWE.
WWE. You're wrestling, are you? Okay.
I don't want to be.
No, I can understand that. It's alright. So, okay. But I know it's an uncontrollable weird interaction, isn't it? Oxygen stats at 97%. Heart rate at this time is 97 beats per minute.
My heart is not happy.
Your heart's not feeling happy.
No.
Max and Willow are over there. What do you mean by not feeling happy, kitten?
This was funny.
Oh, Baba.
It's not helping my sore.
Not helping your sore hand at all. It's okay. Okay. It's okay. Alright. Okay. You're there. You're there. No, it's okay. It's okay. It's alright. You're doing super, super, duper well.
Stop. Stop, stop, stop.
It's alright. It's okay.
Oh, Max.
What's your body feeling, kitten? Tell me. What's your body doing? What's happening? So a lot of these uncontrollable motor activities are more seen with the Tourette's storm, okay? You can see that Maxie and Willow are both concerned. They're both looking on carefully and cautiously, see if they can help. Now, there's a mixed bag of neurology that happens for Dyan. Seizures, dystonia, and I can see that there's been dystonia engagement already, particularly segmented cranial dystonia in the face, affecting the eyes, sublepharospasms, oromandibular. I can see that the Tourette's is kicking in with a lot of tick action. And
deep fried banana.
You want deep fried banana? Right now, you would like deep fried banana.
Yeah.
Okay. Weird neurological outbursts.
My brain is getting delayed. It's getting delayed.
Okay. Okay. Just because you have pads is not there for you to bang shit. Okay. So let's less bang, no bang.
I don't have control.
Right, grab Gingerbread Man, and I want you to hold him, and I want you to squeeze him, boo boo. Okay, let's see if that helps as a distraction and a redirection for what you're going through. No, boo.
Now I'm sensory overloaded.
Okay.
I'm in pain. I've got this stupid thing.
Oh, I know. They are sensory overload.
This stupid thing.
Yeah.
No.
At the moment, I'm pausing on not putting the hand mitt onto the other hand because I've got equipment, medical grade equipment. I don't have a foot-based probe. I need that data to know if her heart's doing anything weird or oxygen levels are going, so I can make more informed clinical decisions as I'm going along. So it's not helping, and it is a bit on the difficult side of things.
No.
Now, there's some medications that I can obviously apply. We've already had a Valium as part of the nighttime routine, 5 milligrams. That should be helping to relax. She's already had a clonazepam, 2 milligrams. That should be helping relaxing the muscles. That's why we've got the timer going up the top here, and that's actually at 4:34. So that gives me a 20-minute countdown where the clonazepam should be kicking in and helping with things like the dystonia and the Tourette's activities. Okay, let's not create extra bangs that you don't need, Kieran. Oh, sweet pea. Right here. It's okay.
I'm feeling a little relaxed.
Good.
The medicine.
Good. Because if she doesn't, and this keeps going, this is why we have the timers, then I have to, part of my flow chart is know when to intervene to the next level and the next stage of medications. Okay? So there is a rationale to this, there is a timing protocol to this, there is a flow chart. If things go this way, I do this action. If I go that way, I do that action. Unfortunately, it's a bit of a mixed bag. I am dealing with someone who's got cardiac dropouts that are going on, oxygen stats that are hovering and flipping down to 90%. You've got dystonia, which is a movement and muscle contraction disorder happening as well in the face, and that can affect other areas such as the diaphragm, intercostal, esophagus, and affect swallowing and breathing. We have also got Tourette's, so you've seen motor tics and vocalized tics also going into a bit of a dystonic storm and a Tourette's storm, so I'm trying to suppress those. What I was trying to get in front of is hopefully, but there's no tonic-clonic seizures. Now I'm hoping that the medications that we provided will cause that not to actually occur, so fingers are crossed. But I am seeing in the face a lot of action still around the oromandibular and the blepharospasm. So at the moment it's controlling how the eyes are operating, it's controlling a little flexion that's occurring, and that's a heart rate drop off on the alarms. So at the moment we've got the heart dropping into 48, 49, oxygen stats are at 96, so there's different thresholds that are occurring. Sorry, bud. Hopefully this will pass very soon for you, okay? It's better? Cool. Max is doing his best to pretend he's Superman over there. Will I? Yeah, well, he's just being Will I. You're doing super well, body. The body's relaxing, starting to rest. So we're on a observe, wait and see. It's 5:54 p.m.
I am safe now.
Well, we'll see. We hope you are, sweetie.
Am I?
Yeah, we hope so. Wait till I see things settle down.
Please.
What do you need?
He's Superman.
He is Supermaning, exactly.
Here.
Yeah, just relax for the moment. He can see you there. Postictal aphasia after seizures can cause difficulties with speech, slurring, stuttering, word finding difficulties as well. There was a lot of pain yesterday after yesterday's quite significant, strong and prolonged tonic-clonic seizures. It caused quite a lot of neck pain and difficulties in the neck for Dyan, and some of the other joints that she has as well. So she was in a lot of pain all last night and this morning. Hi, darling. It's all right.
Medicine's kicking in.
Medicine's kicking in. Yeah.
Have I improved?
You're starting to improve, sweetie, slowly but surely. That's again why we have the countdown timer behind my head working as we look.
Cold.
It's okay. We want you cold. We don't want you overheating. Quite commonly, febrile is one of the key indicators of triggering seizures. Light flickering, just simply light sensitivity, can cause a hypersensitivity light can cause trigger seizures for Dyan. Having obviously infections is another precursor into seizures, and Dyan's got lots of antibiotics that she's on simultaneously at the moment, dealing with multiple infections in her body that have been quite long term. So she's got a lot of the precursors are what will cause neurological triggers to different types of events like this. You want KFC and HJs at the same time?
I was thinking HJ.
Right, I'm thinking of salad, peas and corn, and all your healthy diet things that you have.
But I want it to be a normal person meal.
Okay, a normal person meal will cause you to have what?
A lot of problems.
A lot of problems. Hey Google, stop. So how's your body feeling? That's the 20-minute countdown timer after clonazepam has been applied.
My head hurts really bad.
Okay, I need to give you a gabapentin to actually help with that side of things.
I had one today.
Yeah, that's one today. And guess what? You're going to have more today. You can have up to 3 of those in a day. In fact, you can actually have up to 4 in a day if you needed to. But we are doing only another one.
Only because it's so bad.
It is so bad, and
But
I'm glad you agree.
like
Normally, Dyan's very resistive to me towards medications, and that's part of my juggle as being the
They
caregiver
make me feel yucky.
and guardian to make sure that I'm making sure that she's getting the appropriate medication at the appropriate time and at the appropriate dosages. We start low and we go slow with any medications because they can cause a lot of other exacerbations. That's good, boo-boo. Let me just get you some GABA.
I don't like the feeling. I need my scalp pulled. I need you to pull my hair.
You want me to pull your hair? Okay.
At the skull.
Right.
My skull's in pain. It's too tight.
Now I'm going to sit you up.
My hair's too heavy.
And your hair's too heavy.
I wish I could shave it off.
You don't want to shave it off and lose all that lovely hair. Okay, I'm just going to pop this in your mouth and I'm going to help you with this. Good girl.
I did it.
Good girl. Very difficulty with dysphagia, difficulty in swallowing and the abilities of the muscles that control that whole swallowing exercise. Dyan's got quite significant dysphagia that has continued to deteriorate even further and is tied into a neurological condition. How are you feeling?
Yeah, I'm much better. My body's relaxing.
Great. So we'll apply the appropriate medication at the appropriate time. So I'm going to start by taking this off first, off your hand. If you keep your hands still for me, I'll be able to get it off. I know you think you're trying to help, but you ain't helping now. It's okay. They make it complex for a reason, I'm assuming. It's like a straitjacket for your hand.
Yeah, it's slowly getting more damage.
It does. So that's a bonus and benefit of that approach, isn't it?
Yeah.
If it keeps you safe. So these are padded mitts that we use. In the old days, I used to have to use compression bandages to go around the hand and literally sometimes put some foam or a flannel or something inside and pad it up that way. So to improvise just some sort of padding type device until I see that things totally settle down before I'll take the scalp cap off, which is a head protection device. We actually got this from Epilepsy WA, very, very good resource. And each of the states across Australia will have their own epilepsy centre, great for advocacy and education. Sometimes they'll hold conferences. Sometimes they'll do fundraising type activities. They do training for nursing staff, your disability support workers, family members to be more aware of seizures, seizure management, creating a seizure management plan, seizure medications. But they also have a lot of resources, such as the 73 seizure camera, the night watch, seizure detection device, things that we actually use as part of the protection and monitoring and alert systems to keep Dyan safe. Head protection, such as the cap that she's wearing. They even have other sort of padded protections that are available, and they have a resource library so you can go in, try these different things and find out what actually works for you specifically before you actually go away and purchase and buy those things, because a lot of these things can add up in pricing.
Microcephaly.
Yes, you do. What is microcephaly?
Small head.
Yep, it's the small head circumference. Which means that you have less room.
Stupid.
No, it doesn't mean you're stupid at all. You're actually super duper highly intelligent, but you learn in a different way. Now, Dyan's genetic chromosomal condition does cause her to have GDD, global developmental delays, and IDD, intellectual developmental delays. Yeah, because your brain didn't form in the right way, obviously, and in the developmental stage, that's what it causes. A lot of center and midline related issues. So with people with 22q, they can have cleft palate, cleft lip, high palate. Dyan's got a high palate related issues. About 65% of patients with 22q will have some sort of cleft related issue. Seizure disorders, like I said, are very highly prevalent because the incident rate or the threshold for seizures is incredibly lowered because of issues with electrolyte balances, whether it's the right calcium, potassium, magnesium, whether it's thresholds because of febrile high incidence rates of those, or fevers, and of course having infections. All right, let's do that if you feel up to it. Super duper effort, but no worries. So this is the one that we've got for Dyan. It is a soft cowl. It is adjustable. It's called the head saver, and it does have a strap. And straps are very important so things don't actually come off, get knocked off during things. Okay, and she actually has with hers as well a scarf that can be worn so that she can wear that over the top of that if she's out and about to disguise the fact that she has a helmet on as well. Going to take an updated blood pressure test. She's really complaining of a persistent migraine and headache. Now, we've obviously done half a rizatriptane wafer. Normally, if the wafer is not sufficient enough within half an hour, we can do the other half of that. She's had some gabapentin, which will work on the GABA component of the brain. You've already, I think you're at a high level. So you can either go half a rizatriptane wafer, or we can go the tramadol route. What would you prefer to do? I can microdose you with tramadol and step you up.
Because the waivers for days haven't been working.
Okay. And sometimes you've got to find the right medication that actually does work in this situation. I do suggest.
Calcium that causes it to not.
Yeah, it does. And look, you've got a lot of neck-related issues going on at the moment, so your CCI is affecting things significantly.
Yes.
Help you out. Room temperature has come down. It's currently now 23.7, so we've got that under control. Outside temperature is 23. It has got up to about 27 degrees today, or 28 degrees. It's been quite a warmer sort of day here in Perth, and we've had a few warmer days. As soon as the hotter weather comes in, and we've been very low normally around that 20 and below 24 months, now that we've stepped in to the slightly hotter weather, it becomes for us seizure season. Okay, hot weather always spells the step up of having more seizures for Dyan during that point in time. It's just what happens for her. And we've been tracking this for over, 13 years. Blood pressure is 102/64. Heart rate is 53. That's the alarm saying that heart rate's now just dropping down below 50. 49, 48. Oxygen stats are good at 97. Dyan's in a version of syncope at the moment. She has passed out, and the syncope will be tied into her orthostatic intolerance. So as the heart rate drops, the flow of oxygen to the brain also is dropping, and that's causing the syncope or fainting that's occurring. So she has a correlation where the heart rate does a sudden dive out. We can measure that as obviously the alarms come in. If she's having syncope at the same time, we're just not delivering that blood flow, oxygen flow to the brain simultaneously. 48, 47, 46. Right, we're going to raise the head of the bed. We have orthostatic intolerance. It actually is a benefit if we actually increase the head postural position and elevate it slightly. Current time is 6:06 p.m. Hi sweetie, you've just been passing in and out with syncope at the moment, okay, and your heart rate's just been dropping down as well, alright? So you might feel a bit groggy and feel a little bit out of things. It's alright.
I need a good toilet.
Yeah, well, I might just have to wait for the moment, sweetie, because you're not in a walkable state, I'm afraid. Oh, bloody Fukushima. Okay, this is going to be a bit of a challenge, isn't it? So she's at a stage where cognitively she's not really with us. She's passing out.
It's too much for the hoist. I'll just crawl.
Yeah, I'll be carrying you. Can you just wriggle your toes for me? Okay, so we've got mild movement of the legs. I'm going to obviously partner assist and take her to the toilet. We'll be back in a moment.
I've got my cat.
You've got your cat. That's really helpful. Can you get yourself into bed?
I want my cat.
Okay, well you're not doing too well on the getting into bed part of things, are you? Yeah.
He doesn't want me.
Yeah, well he knows probably that sensation of I don't feel terribly safe with you carrying me or holding
You
me.
keep folding my blanket.
You're welcome.
This is my best one.
Right. So that was
It's
actually very
freezing.
difficult getting down to the toilet.
Freezing.
Ataxic walking, a sludge where she's literally just sliding her feet along, not actually able to lift her feet.
What's that?
A counterpoint where she's actually not balancing in the vertical at the moment, and there's obviously very limited strength in coordination and doing things. So that was a difficult exercise. Now it did actually elevate the heart rate up because obviously she's upright, orthostatic intolerance, and having to move, so that brings that on. But it's not something she could have done by herself. So we do have other solutions if we're stuck into this situation. But again, we escalate where appropriate into doing these things. Now, if you're new to the channel, as I was mentioning before, Dyan's got this genetic chromosomal condition. It's a micro deletion on the long arm of the 22nd chromosome. We have 23 pairs of chromosomes. She's got a deletion. Some people can have a duplication where you replicate and double up. So she's got a micro deletion in that long arm, and she's missing anywhere between 30 to 50 individual genes. And some of those genes are very important. They obviously form everything that goes throughout the body. That's why 3 million DNA building blocks are also missing. And they can create anywhere up to 185 clinical symptoms in patients with 22q. Okay, so that's a bit concerning. And John's got quite a lot. Just like autism, ADHD, OCD, and Tourette's, if you've met one person with that condition, you've only met one person. It's variable, it's different. Each person is slightly individual in how they present, what individualized symptoms that they have.
I'm very hungry.
Right, well, at the moment, I'm not going to feed you with the dysphagia until I see whether this is all finished and settling down, okay? But as soon as it settles... Darling. Okay. Let's do that together.
I've forgotten.
You forgot it, exactly.
I always forget the pain.
Yeah, you forget the pain.
But it's delicious.
I know, right? These adverts are very tempting. Yeah, it would be a whopper if you had some. Gastroparesis is the dysmotility of the GI tract. Nothing passes through Dyan naturally. We need to have industrial strength medications to actually break that down. And when we take that medication, it causes a lot of extra pain, discomfort, and also pressure onto the heart. So it's not a great thing. You're saying that you feel like a lot of pressure in the head, is that correct?
Yeah.
Okay, so
My skull hurts.
your skull hurts. So when you say your skull hurts, is it like a bulging sensation? Is it pushing out from the inside out?
Bones are, yeah, like underneath my skull, like it's being pushed.
Okay, makes sense.
It feels like my skull's just in pain because of it. It hurts.
Now, it's...
But when I do this,
Yep.
it helps.
It does, because that actually stimulates some of the blood flow in your...
And
there's a lot of...
Away.
Yeah, there's a lot of capillaries in the outer layer, so it helps the blood flow. You're also trying to alleviate some of the pull down. So some of the muscles, particularly the trapezius, which connects right at the very, very back. Yeah, right at the very back there. And that's where your big muscle of your back's pulling it down. And a lot of it's because it's protective mechanisms around your CCR, the cranial cervical instability. Dyan's neck's been really out of whack for a period of time. While Dyan's trying to do some gentle stretching exercises that we do to help alleviate the tension from some of the pullback of the muscle groups. Just want to talk about glymphatic dysfunction. This was a conversation that we're having with Dyan's GP only the other day. And it's a bit frustrating because, look, he goes, this could absolutely be something which we need to be aware of and to actually test for, and it makes sense. And the reason why I bring glymphatic dysfunction up, it refers to an impaired functioning of the glymphatic system. There is some testing that's available. It's non-invasive, which is always good if you don't have to go inside and do surgery to do something. So it's non-invasive use of what's called a diffusion tensor imaging, DTI, and the markers like the analysis along the perivascular space, ALPS, index. Now, why do we talk about this? Well, a lot of people on this channel do have 22q, or they might relate to it from their own genetic disorder. Now, recent 22q research published on MedRx as of September of this year combines that DTI and magnetic resonance spectroscopy, MRS, is useful to investigate the glymphatic function in patients with 22q11.2 deletion syndrome. The study observed a reduced ALPS index in individuals with 22q11.2 deletion, with a particularly divergent developmental trajectory in those with positive psychotic symptoms, PPS+, compared to those without. So what is this glymphatic dysfunction? Glymphatic dysfunction refers to the impaired functioning of the glymphatic system. That's the waste clearance system in the brain. And that relies on the cerebral spinal fluid, the CSF flow, through the brain tissues, primarily during sleep. This dysfunction can lead to the accumulation of toxic proteins like the amyloid beta and tau, contributing to the development and progression of neurological diseases such as Alzheimer's disease, Parkinson's disease, as well as causing sleep disturbances and headaches. Factors that can impair glymphatic function include sleep disruptions, certain sleep medications, aging, and potentially lack of adequate exercise. So what are the related symptoms for Dyan? What we're concerned about? Seizures. Glymphatic dysfunction may contribute to epilepsy by impairing the brain's waste clearance system, leading to the accumulation of metabolic products that could trigger or exacerbate seizures. Emerging research for 22q shows that the lower ALPS indexes, the measure of glymphatic function in individuals with certain epilepsy types, like generalized tonic-clonic seizures, GTECS, and these low indexes are associated with increased seizure severity and cognitive impairment. This suggests that glymphatic system's role in epilepsy pathophysiology and potential as a biomarker for disease burden. Then there's the intracranial pressure. Dyan keeps complaining for years of this intracranial pressure. Glymphatic system dysfunction can contribute to elevated intracranial pressure, ICP, by impairing the brain's waste and fluid clearance mechanism. Impaired drainage of interstitial fluid can lead to its accumulation, potentially increasing the pressure within the skull, which is characteristic of conditions like idiopathic intracranial hypertension, IIH, while the exact relationship is complex and still under investigation. That's your heart dropping off again. You've also had some oxygen drops down to 92% during this. So while the exact relationship is complex and still under investigation, reduced glymphatic flow is a proposed factor in IIH pathogenesis. Dystonia. Glymphatic dysfunction is recently studied aspect of various neurological conditions, including some forms of dystonia, such as blepharospasms that Dyan also gets. Okay, so that's concerning. Migraines. Glymphatic dysfunction is increasingly linked to migraines, as an impaired brain waste clearance can lead to the buildup of neuroinflammatory molecules, triggering and exacerbating migraine attacks. Tourette syndrome. Glymphatic system dysfunction is a proposed mechanism in Tourette syndrome where the brain's waste clearance system is impaired, potentially contributing to the disorder's development and symptoms. Research shows that reduced clearance of waste products via the glymphatic pathway in TS. So this dysfunction may be linked to factors like the altered aquaporin 4 or AQP4 distribution, affecting how cerebral spinal fluid and interstitial fluid moves through the brain. Well, this is interestingly the question. The doctor said, yeah, you really need this testing, but
money.
No, it's not available here in Perth, sunny Western Australia.
Eastern state?
I don't know. So we're going to have to do our own research and reach out.
No.
So that's the reason why I'm talking about this glymphatic dysfunction. If any of you know anywhere across Australia any information on the testing, which is called DTI, Delta Tango Indigo, which is standing for diffusion tensor imaging, and for the markers called analysis along the perivascular space, ALPS, that's what we need to actually find out how we can access it.
Fly across, and would I get a flying clearance?
At the moment, medically, no. You'd have to be travelling with a doctor or a nurse because of obviously the risks that we see here.
I can do that 24/7. I can.
Correct. We can get support staff once we get up and go.
A staff member willing to do
that. Now let me just finish off this conversation, because 22q deletion syndrome specific research is new, okay, and this is a problem with older information that exists, particularly around some of the older names like DeGeorge. Okay, you must do your reference and you must do your research for the specific genetic term. 22q 11.2 deletion syndrome.
And do you know they've been calling that since the 90s?
Correct. It is so outdated that people are still looking up terms such as DeGeorge, velocardiofacial syndrome, Spritzgen's disease.
22q's been the name for
many old names still exist.
30 years.
Now, the glymphatic dysfunction in 22q refers to impaired clearance of waste products from the brain. Now, the reason why I talk about this is this came up and was flagged with another one of your conditions, which is caused by 22q, which is your CCI. Cranial cervical instability can disrupt the brain fluid flow. Because you've got issues up the top here, the brain fluid that comes down into the spine is not working properly, potentially contributing to glymphatic dysfunction.
As during my video, they know.
What happened?
I said I was supposed to tell you. I forgot.
What did you forget to tell me?
When I did my video this morning when you were having a meeting.
When I was on my very long meetings, because I did lots of long meetings today with the NDS. 2 phone calls, 3 hours meetings. Yep.
I had like cold water on this side.
Okay.
Here.
What does the cold water symbolize sensation for us? What does it tell us?
That tells me there's definitely a seizure coming. I just don't know when.
Yeah. So when we look at the pre-ictal indicators, prodromal before a seizure for Dyan, if she gets a sensation of, like she describes it as, either ants or running water down the side of her face.
It's like it's cold.
Yeah. And within 24 hours, we will normally be having seizures. So we look at these indicators to give us early determinations of if there is a likelihood of having a seizure. And also when we can actually counter that. So if it's sleep disturbances, migraines, changes in electrolyte imbalance, high temperatures, flashing lights, sensations, I can see that you're starting to come around.
Getting better.
Good.
But guess what?
What?
My eyeballs hurt so much.
Yeah.
Can you get my lackey? Because Maxie will get it.
No, Maxie's asleep over there, so I can see your lackey. Can
Max
you do me a favour?
Sleeping like Superman.
Can you just take the heels of your hand, rub them together so they're warm, like that.
Like that?
Yep, like that. Yep, just rub them together.
Tickled.
Yep, make it warm. This is like the wax on, wax off grasshopper. Wax on, wax off.
I love that movie.
Karate Kid. And what I want you to do is put the heels of the hand onto your eyes and press in for me.
My hands are warm enough.
Okay, so once they're warm. So while we're doing that, got you something to do. So CCI, cranial cervical instability, it can disrupt the brain fluid flow, potentially contributing to glymphatic dysfunction, a condition where the brain's waste clearance system becomes insufficient. CCI involves instability in the neck, particularly the upper cervical spine, which can compress jugular veins and stretch the vagus nerves. The vagus nerve is affecting, the vagus nerve has been attributed to causing dystonia. It's been attributed to also Tourette's. It's also been attributed towards, would you believe it, gastroparesis,
wellness
because
coaches have hijacked it. Don't believe wellness coaches. They're full of shit.
That's the snake oil salesman of the multi-level marketing industry. But the vagus nerve is also known as from Latin, the wandering nerve. It's the longest nerve in the body. And it's one of the 3 nerves, cranial nerve as well included, that's actually affected, particularly in patients with 22q for early development. So again, as a person with 22q, you need to understand what parts of your body could be affected. There is a lot of information that's available in the clinical guidelines for this condition and medical journals. But when you actually read it in conjunction with all of this other information, so if you understand that the CCI, compression of the neck, is pressing down on things such as the vagus nerve, if that same vagus nerve is a contributor to affecting things such as your dystonia or other conditions like dysphagia is associated to, and also gastrointestinal related issues such as gastroparesis, it's so important to understand how they all interact. So this disruption with the CCI may impair the glymphatic system's ability to clear the waste from the brain, leading to neurodegenerative processes, brain fog, and other neurological symptoms.
Yeah.
And the problem is, we don't have a neurology team here in Perth to be able to support this or to do the tests. We don't have a clinical specialist for adults with 22q in Australia. This is our issue. Can we go to another country, please?
Can I also explain
Please do.
that I want to dispel the myths of the godlike appearance of hospitals and specialists. A neurologist, not all of them are an epidemiologist to help people like me. So it is a very specialist area, neurology, because the brain is a very complex thing.
Yep, and they know so little about it.
So I don't have access to a higher level care that I truly need, which actually puts my life at risk.
So these are some of the challenges that we face. This is some of the conversation that we're having with our local WA Health Minister, Health Department, and the local hospital.
This is the worst place apart from probably Tasmania, maybe?
I'd say so, for access to these sort of equipment and specialists.
But at least Tasmanians, you guys can go to the mainland.
True.
Whereas here...
Delivery. Right, so we do have a delivery. That will be Sheen. I need to go downstairs and collect it. Isn't that good timing?
I've done Christmas
that you've recovered enough so that we can have a look at your Sheen delivery. So stay tuned for another video on that one. Oxygen stats are good. They're stabilised at a nice 98%. Heart rate's actually increased a little bit to about 63 beats, and it seems to be stabilised as well. How are you feeling cognitively? Is your brain coming back online? Except for the Tourette's just then. Okay. How's your brain? How is your brain? Clearer.
The pain on my skull has notched down a bit.
Okay, good. All right. So you feel clearer of head, pain is reducing.
I still feel
slow. Okay. Well, we're certainly going to take things carefully and slow for you. I think we've managed to escape going into tonic-clonic seizures because of, you're not having it, because of the early intervention with medications. We've been able to save her going into seizures today, and that's a good thing as far as I'm concerned. How it then actually presented with, obviously, Tourette's and dystonic storm, not very helpful, but the other medications, the muscle relaxants and all that, kicked down, and as you could see, it slowly wore in, absorbed, and obviously the symptoms started to reduce. Great, happy for all of that. Now remember, any of the information that we share is not directed at you for diagnosis purposes, or treatment or management guidelines. That's what your own GP, primary care physician or specialist is. So please go and see them for the appropriate testing, and particularly look at genetic testing, because look, with over 7,000 rare conditions and 250 new rare conditions added each and every year at this stage, it takes anywhere between 10 to 15 years to get diagnosis, and only 5% of those rare conditions have actually got treatment processes that actually help those people at the moment. And
my scientific belief, based on lots of scientific journals in psychology to do with autism, that a lot of us have syndromes. So if you are autistic, you must try to access genetic testing, because there could be a syndrome reason for you having autism.
Do you mean why your family and their parents and the parents before them
it's
all
a genetic
had hereditary genetic autism? Do you mean it wasn't the Panadol?
No.
Oh, okay. Well, I think we've worked that one out anyway.
I'm just basically saying, like, you know, sometimes diagnosis, people think, that's what's wrong with me, that makes sense, and they leave it at that.
Correct. So with Dyan's...
never normally have one.
No. And with Dyan's very specific genetic condition, 22q, 30 to 40% of those people will be likely to have autism.
Maybe
50 to
higher
60%
if they're
will
not
have
doing testing.
ADHD. Okay, this is a statistics that's available at the moment. Now remember, they haven't done the full longitudinal studies. That's just at the early stage of things. Their longitudinal studies don't go past 30 years of age. Okay, it's a life-shortening condition.
And
41.5 years of age is commonly seen as the mean or average age. Why is your heart playing up now? 48 with a drop-off. 47. Okay. This is going to be a bit of flapping and looking for a little while. We're going to keep you sitting upright. We're going to try and give you some food, which will hopefully revigorate the blood flow as well. What were you saying? You just relax. I think your brain's going a little bit offline, and I'm not surprised with syncope if your pre-syncope still showing heart rate is at 46 beats per minute at the moment. All right, sweetie. So a bit of syncope probably happening around pre-syncope, which is a bit of cognitive confusion. 46 beats per minute. We've still got this going statically. How are you feeling, sweetie? Dyan's forgotten what she's saying. Okay, so you can see the alerts and the alarms slowly coming back up. So this is the heart rate part over here below threshold. She'll come back up shortly to that first level. I'm not stressing because we have 2 levels of alarms with heart rate. She's showing syncope right now, 6:30 p.m. Still on observer mode. So this is not over. It's not over until the fat lady sings. In this case, there isn't a fat lady, but this is going to be a night for a while. I'm going to monitor the symptoms around heart, trying to do things to bring the heart rate up and the blood pressure up. You're still recovering out of it. I'm so sorry.
I need chicken tenders.
Honey, I've got nowhere to go. I can't go and get you weird food like that, but I can make you some lovely food here, which will be palatable and be okay for your gastroparesis.
Okay.
Okay. It's going to take hours. We haven't had much. That's because your brain's going offline. It's not getting enough oxygen flow to it, and it becomes a confused state. Pre-syncope into syncope, fainting and passing out.
I got work to do and I got to do the budget.
Sweetie, I can imagine your calculations right about now. Your budget would not be adding up terribly well. Trust me on that one. Oh, sweetie. This. See the ins and outs? Confused state. Hi, Maxie. You can come and help too. So, as I was saying, we're not medical experts. Please come see your own people for doing that sort of thing. We are here, however, to educate and to advocate around genetic conditions. And there's a lot of information that still needs to be done, research that needs to be done. Dyan's part of multiple research studies across multiple countries at the moment with her DNA. And that will hopefully help to improve the pathway for getting better access to care and also management and testing facilities. So it's a process. Okay, it's one day at a time. We're very tired at the moment. We've been dealing with the NDIS and health departments daily. I've spent hours on the phone, hours on emails and messaging. Hello, Maxie. You are the best medicine around, if you ask me, isn't he?
He's doing.
I think you would all agree. So give us a big thumbs up of encouragement. He's the weighted cat.
He's very weighty.
You're not really. You're a featherweight. You're a lightweight. If you have got comments, questions, ideas, and suggestions about anything that's happened or we talk about, particularly things like glymphatic dysfunction, please let us know your thoughts below. I'd love to hear from you. If you know about any of the testing or some of the things I've talked about, please let me know. Unfortunately, this is where we need to reach out to centres of excellence, and we might need to reach out to other countries, particularly like the Mayo Clinic and John Hopkins and other sort of areas in the US, to see what we can find and see whether there's access. But you can't do testing online, and this is the problem about having to do things in person. So this is one of the realities that I'm pointing out. Your doctor has identified that this is something which we really should be checking out, particularly in line with latest research for 22q and all of your symptoms across multiple different diagnoses that you've got. You don't have access to the testing equipment, regimes, or the people knowledgeable enough to understand how to interpret, read them, and then manage them and treat them. So
You want Daddy.
the struggle is real, isn't it? Guys, if you're new to the channel, don't forget to subscribe, hit that notification bell. Am I getting some licks? Thank you. I appreciate that.
He loves us.
He does love us. It's great to have a Max. I hope you have a Max in your life
You
as
know
well.
what? Max has brought so much joy to not only us,
Yeah.
but Willow as well.
You have. You are
He
super
has
Max.
just brought so much love to this family.
Exactly. Your heart rate's still flapping. You're currently at 51 beats per minute. Your oxygen sats are at 97. You have had a drop off down to 91%. So we're still not out of the woods. I'm going to be keeping an eye on Dyan and trying to bring that up. And he's still showing signs of looking very tired, fatigued, and cognitively a little bit offline. Wish us luck, and we'll hopefully see you in another video real soon. Bye for now.